Welcome in. Good Friday or Sunday evening to you. I forget sometimes that our Friday programs also air on Sunday. It's a pleasure to have you aboard. You noticed the message there at the top. Tonight's program will be specifically geared to the conversation of weight loss. Now, a lot of you think, who are you to be talking about weight loss? I will tell you that the television adds 10 pounds. I'm just explaining that to you. But I'm told that we should probably formally start the show, so why don't we do that?
The Dan Yorke State of Mind program is brought to you in part by Lookout Rhode Island and Takeo Comfort Solutions.
That's a communication between the director and me. That almost went exactly as planned. But anyway, people see me every once in a while, and they say, "Gee, you're not as fat as you look on television." I said, "Well, gee, thank you very much. I guess that's okay." It's been worse. It's been worse. There was a day when it was this big. We're gonna skip the rundown and the issues of the day today just to have a conversation about this. And before you decide, oh, Dan's not digging in on the issues, or there's no big controversy going on, sit tight, because I doubt there's anybody in your home that doesn't, or in your life, that's not dealing with weight issues. And then the big question for those who are obese, which is a tough term for us lay people, right, to determine who is and who's not, there's the surgery thing. And our guest tonight will explain all of that. And here he is in action. And it is action. It is surgery that is very serious stuff. Boy, I almost thought that was a still photo there for a second, Doc. You've got a steady posture and obviously a steady hand. Dr. Pohl is here, surgeon and director of the Weight Loss Surgery Center at Roger Williams Medical Center. It's an honor and a pleasure to have you aboard. Thank you very much for coming.
Thank you for inviting me. My pleasure.
All right, let me ask you this. Am I a candidate for surgery?
Just by looking at you, I would say no, but I mean, I would have to calculate your numbers there.
So there's a caveat?
Well, I mean, I have a little experience after having done 3,000 weight loss surgeries.
Come on, guy walks in and looks like this.
No.
No, thank God. All right, okay. It's not a laughing matter. It's a very serious issue for a lot of people. Before we get into the concept of surgery and the stuff that you're doing there on video, talk to me about the trends right now. In fact, I've got a headline here that shows you that women are catching up or blowing by men. Troubling shift in American obesity. Women surge ahead of men. 40% are now obese. And of course, the media always has to show, somebody's derriere or whatever. I mean, I think we know it'll, talk to me about the overall trend, the people you're seeing and what you're dealing with.
Well, I think the trend is true. I mean, what they say is true. Since for about 30 years, the society in whole in the Western world, not just the United States, has become more and more overweight. And also the perception of our weight has changed. What used to be normal weight now is almost looked at being too skinny. And what used to be overweight now is being looked at as almost normal. Because as this study,
Say that again?
Well, so in the past, like my father-in-law, when he enlisted to the World War II, he was fit to be a soldier to go overseas. Mm-hmm. He was 68 inches tall and weighed about 140 pounds. That was normal, fit to go to war. If you see a person like this right now, you would say, "Oh my God, you're too skinny." Whereas if someone weighs 180 pounds right now or 200 pounds, they're a little stocky, we'd say, well, this is a good person, there's good weight for him. So this perception has kind of changed. So people don't realize when they're actually overweight these days, because so many people in our society are overweight. And just in Rhode Island alone, there's 250,000 people who are overweight. And in Rhode Island alone, 40,000 people are so overweight that they qualify for surgery. 40,000 people in Rhode Island alone.
All right. Well, that's
it's a big.
That's
health
damning.
concern. Yeah.
That's a bummer. So, am I obese?
Again, I would have the terms obesity go by what's
pretty
called
gutsy for
body
me to
mass
put
index.
myself up like this, don't you think? But no,
I'm
seriously.
impressed. I'm
no,
impressed.
No, am I obese?
Yeah.
Am I obese? I'll tell you what. I'm going to tell you right now. I've dropped 13, 14 pounds here in the last 6-8 weeks.
That's great.
You know why?
Congratulations.
I finally said, you know what? I'm just going to knock out the late night.
Yep.
Stop.
Yep.
When dinner's over,
Yep.
dinner's over. Have a cup of tea
Yep.
and let it pass. And that alone, along with taking some junk out and lessening the carbs a little bit, I haven't done anything specific.
Yep.
But, you know, and I plan on just trying to lose 3 or 4 pounds a month for as long, you know what, if I just keep correcting, it seems like it's starting to correct itself. Well, gradual weight loss is what you want, correct? But the idea that every chart I look at about the definition of obese, I'm obese.
Yes.
Is that fair?
Well,
or is it true?
It's true. I mean, it's because we know that even with the weight that you think may be normal for you, but by the chart you are obese, it causes damage inside of you. And that's really a thing. If you were obese and nothing would happen, well, be obese, doesn't matter. But when you are overweight or obese, you get diabetes, you get heart disease, you get blood pressure issues, you get cholesterol issues, and even the rates of cancer are higher. Women after menopause, their breast cancer rate is twice as high. You get colon cancer, prostate cancer. I mean, all these things happen in the body. They're silent, they're slow. You don't see them, nothing bad looks like it, but in reality, while you're sitting here, your body is doing damage to itself. That's why you want to get rid of the weight.
Pretty uplifting program.
Yeah, but the good thing is, the uplifting part is, you're doing it perfectly right.
Yeah.
You're not going on one of the fad diets.
Right.
You're not buying supplements. You have the good mind to this. You have a good mindset, and that's what it's really all about.
Well, you know, it's listen. This is a serious conversation for a lot of
It
people
is,
because
unfortunately,
I can tell you. Here's the better news. I used to be, well before this audience met me. I had a bad 8-10 years. You know, as a younger guy. You know, up around the 255, 260 range, and it was heavy, and it was no good. And so, you know, where I am right now is, you know, 35, 40, 45 pounds less. And I know another 10 or 15 will make me feel like $1 million, and so we'll get there. But I bet you, even when I get that off, you'd still go, you know. And I wonder whether these trends now versus what was defined in the past. You're saying, guess what? Just because we've come to accept a certain amount of satisfaction, it doesn't mean it's correct.
Correct. You're right.
But there's just so much crap out there, right? There's so much junk that you can have.
Yeah,
There's so much. There's so many heavily advertised, programmatically poor for us foods and diets and everything else. That it's a hard thing, man.
But that's why I think you're doing it the right way. You're not going from one fad, meaning eating Chinese food and pizza all the time. You're going from that to eating protein shakes all the time.
Yeah.
You've made your mind up. You say, I gotta change my lifestyle. No one told me that
It's
I
so
have to eat
cliche to
pizza.
people.
Well,
But it actually works.
it is the only thing that works.
It's hard for people who feel when they're at the end of their rope, who just say, I am so heavy, I don't feel well. Or a doctor says, by the way, now the clock is ticking on you because you're, then they panic. And then a guy like you rightfully says, you know what, it's a lifestyle change. That feels so immensely difficult to people that's when they go on the advertised programs, right?
Yep.
And so how do we buck that trend or that whole thing?
I think if you found that solution, you and I wouldn't be sitting here if you found that solution. We would be, because that is the big question. How do we buck that trend? With all these programs, even with intense counseling and so forth, the long-term success is unfortunately, and I'm being a downer again, that sometimes call me Dieter Downer in the operating room.
Really?
Well,
Even when you're at the table?
No, not just because I
hope it's Dieter, yay,
No,
when you're
the surgery, yes, but I mean the conversations, because unfortunately that's such a terrible, hard thing to do.
Yeah.
To talk about this issue and not being somewhat negative, because, I mean, the good thing is I have something to offer. That's why I love my surgery, because as opposed to the dieting, the this and that, the other, which has unfortunately a 1% to 2% success rate in the long term, the surgery has a 70 to 80% success rate. So, as you said, how do you get people to make these lifestyle changes? That's where the surgery comes in, because it gives you basically a year where you're not hungry, you're going to lose weight automatically. It's a 100% weight loss guarantee. You're going to lose a lot of weight, and you have that 1 year to get a break. It's almost like detox.
All right. You know what? We need to get into how that all happens. So when we come back in the next segment, we're going to talk about those of you who've tried the the crash diets and the fad diets and failed, and what the health issues are regarding that. The yo-yo factor, and then we'll talk specifically about what the surgery is all about, what that prep's all about, what that whole year's experience is all about, and what the lifestyle change is permanently. Stay with us. Downer Dieter, I'm not going to call you that. Dr. Dieter Pohl is here, Surgeon Director, Weight Loss Surgery Center at Roger Williams Medical Center. That specific stuff that you're seeing right there, I'm sure intrigues you or somebody in your family, and I want to get into the process of what weight loss surgery actually feels like and what the whole thing is all about. But we talked about that, the people that go on these programs and the folks who drop a significant amount of weight and then gain it all back. Is that double trouble?
Yeah, it's not really double trouble. Most people gain a little bit more back than they actually lost.
Yeah.
That's the problem. Because everybody who's gone through this knows that you lose it very slowly. It takes forever to lose those pounds, and you lose it fast at the beginning.
Well, heavy people lose a lot of weight real fast whenever they go on something. Yeah.
Only at the beginning. Then it slows down. And if you lose, people who come to me usually have to lose about 100 pounds. So you lose 30, 40 quickly, and then it slows down. And then all of a sudden you get frustrated, and then you're like, hey, what the heck? I haven't lost for a week, so I might as well eat. And then it took you 6 months to get rid of that 40 pounds, and then it takes you 2 months to gain 50 back or 60 back. So that's a problem. And then all of a sudden overshoot and get more back. So that's that.
But the myth that's out there is that you're in a lesser health position if you've lost it all and gained it all back. It's immaterial. It's just not healthy to be heavy.
It's not healthy to be heavy, yeah.
There's a weight. Well, let's get into the surgery thing. The candidate for surgery is who?
A candidate for surgery is someone who has a certain body mass index, and that's a calculation that everybody can do actually on their own, find out what their body mass index is.
That little clip thing they put right on your waist? Is that what they do?
No, it's actually a number. It goes by height and weight.
Oh.
And I could figure out yours if I had my iPhone. I can put it on the phone.
Really? Do I want to know?
Yeah, you want to know because you're good.
Trying.
You're good.
I'm trying.
But you can look it up on, we have an app, actually, the Roger Williams has an app called My Rhode Island Weight Loss Coach. And if people download that app, they can look up on the app what their body mass index is.
By the way, on foxprovidence.com, every bit of information about our conversation for Roger Williams Medical, that app and everything else you can find on foxprovidence.com after you watch the show. So any follow-up, you can do that.
Thank you.
So the app does a calculation.
There's a calculation, and then if a person has basically no medical problems, completely healthy, then they have to have a body mass index of what's called 40 or higher. Now 25 is normal, up to 25 is normal, and then it goes overweight and then different grades of obesity. And 40 or higher is someone who would be eligible for weight loss surgery.
Ballpark, I know you cannot make a calculation hypothetically, but a 40 or higher is 100 pounds?
100 pounds over usually.
100 pounds?
Yeah. Yeah.
Okay.
Depends, depends on the height obviously, but average 100 pounds.
All right.
If someone has diabetes or high blood pressure or sleep apnea or heart disease, any one of those, they only need to be about 70 pounds over. So they don't even have to be that heavy. And
why is the distinction made?
Because the weight loss surgery works so well for these conditions. And having these conditions is such a high risk of medical problems that the weight loss surgery is way better in terms of risk and so forth and outcomes than having even that condition. Like in the United States, they just published this research that said if people with diabetes had weight loss surgery, they would save, in 5 years, they would save 95,000 pounds per person in medical costs. That's how good the surgery is. It makes diabetes go away. It makes blood pressure go away.
What are you going to do to prepare for the surgery? All right, so I come in, you say, you know what, Dan, here's the bad news. You qualified. Here's the good news. I can help you.
Yeah.
Right? What do I start doing?
The first step is people need to go to an information session. We have several, we have them once a month at Roger Williams, and they can find out from the website or in their office where they are.
Yep.
And then we talk about these issues we talked about today and much more. And then after that, they come to the office, and then they have to go see a dietitian, have a mental health counselor, see your medical doctor, get sleep apnea testing, heart testing. So there's a lot of tests before someone has that surgery. We want to make sure it's safe. It's all about safety. We want to make sure it's a safe surgery. everybody gets out this healthy, everybody has a good outcome. And actually it worked, because with that, the risk of weight loss surgery these days is less than the risk of gallbladder surgery.
Really?
Yeah, that's what the American College of Surgeons has collected all these data and looked at 60,000 people and compared all the different surgical risks. And gastric bypass risk is less than gallbladder surgery, less than appendix surgery, less than hysterectomy, a fifth of what knee replacement surgery is. So,
Really?
yeah,
Most people think,
I know.
I'm going to get my knee done.
I know.
No, no big deal.
I know. They should have. They should go to the cause, the root
Well,
cause.
what are you
of this.
doing? What are you doing? What are you doing in the surgery? Let's get right down to it.
Yep.
What are you taking out, detaching, replacing,
Yep.
squeezing? What are you doing in there?
Yeah. There's two different types of surgery. One is called the gastric bypass, and that is a surgery where we make the stomach as big as my thumb. So your new stomach is going to be as big as my thumb, half an ounce to an ounce in size.
What's the regular
Right now,
stomach look
it's
like,
about as big as 2 quarts. Holds 2 quarts.
though? Oh my gosh.
Yeah, it goes really tiny, tiny stomach. And then we're going to reroute the intestines, and it's a little difficult to conceptualize, but reroute the intestines to the point that when you eat food, the calories do not get absorbed into your body for about 3 feet. And you have about 25 feet of intestines, so there's still plenty to absorb the calories, but the most important part, the top part, doesn't absorb the calories. So number one is you eat less because your stomach is small. Number two, you don't absorb the calories, so so that's an automatic weight loss for everybody there. And number three, the hormones in your body get changed. So for example, the hunger hormone in your body that makes you feel hungry, that goes way down. So for at least a year, people are just not hungry. You don't want to eat. Eating is not an issue. You just don't think about it. Some people have to set the alarm to say, oh yeah, it's 6 hours. I got to drink, I got to eat.
Really?
So that's a perfect situation
What's
for
that do to
people.
their social life?
Yeah, it's a good question. People always think, oh my God, I got to be on liquids forever. No, after about 4 weeks, people eat normal foods. They can go out.
Yeah, but going out to dinner
Yep,
is a social thing.
yep.
You know, business lunches,
Yep.
one thing. But getting everybody together, going out to dinner is a thing.
Yep.
So now your whole body has changed.
Yep.
Are you a party pooper? Everyone else is ordering off the menu and you're kind of going, I'll have one piece of lettuce. Thank you very much.
That's right. You are going to be a little bit in that regard a party pooper. You have to focus on things. You have to say, okay, now you guys going to eat I'm not mentioning all the terrible foods, but you're going to eat this. I'll eat the salad with a piece of grilled chicken. But you can eat a salad with a piece of grilled chicken. Well, you're going to take half or so home with you probably, but you can slowly eat your things while everybody else is gobbling it in. You have one bite after the other. You chew well and you enjoy your meal just like everybody else. It just you eat that much and they eat that much. So that's it. And you take something home, so you save money because you eat 2 meals.
So let's finish up on the surgery itself, then we'll
Yeah.
talk about the psychology and the success when we get back. You're making it tiny.
Yep.
What else are you doing?
Yeah. So that's the gastric bypass.
Yeah.
So tiny stomach. I mean, for people to understand easier, sometimes we just refer to that. This is the thumb surgery.
Right.
And nothing gets taken out, by the way. People always think we take out intestines or colon. Nothing gets taken out. The other surgery is called a sleeve gastrectomy, meaning taking part of the stomach out. So there, what we're going to do is we're going to make actually a long, thin stomach. It goes from the food pipe straight down to the intestines. A long, thin stomach, and it almost looks like a small banana. So it's going to be the banana surgery, so people know what that is. And then we take 3/4 of the stomach out completely, forever. It's completely taken out. And the similar thing happened because the stomach is now much smaller, about 2 or 3 ounces in volume. You cannot eat as much. Portions are much smaller. And food will go through faster in that regard. And that also makes the hormones change a little bit. And you're not hungry. Same thing, that hormone goes
They're
down.
both equally safe?
They're both equally safe.
They both equally expensive?
Same thing, yes.
Okay. When we come back, we'll talk about the economics and what happens to people going forward after surgery. Stay with us. With Dr. Dieter Pohl from Roger Williams. He's the head guy when it comes to this tummy surgery, you know, that everyone wonders about, especially those who are heavy. Insurance cover this? This is optional. or is it mandatory in certain situations?
No, most insurance cover this because the medical society, American Medical Society, has determined that this is a disease. Obesity is a disease. And a lot of insurance companies understand now that obesity by itself costs about $200 billion a year to the insurance companies and the taxpayers.
Young, middle-aged, old, requirements, limits?
We operate on from 18 to no end. I've done a gastric bypass on a mid-70-year-old person. If I can give them 10 years of good quality of life, they can walk, they can play with their grandchildren, they can have a good time. Why not? 10 years is a long time.
A kid that's 20, 25 years of age, and you do this, isn't correcting lifestyle a better choice for them?
Ideally, yes. But again, if they haven't done it by now, the chance that they're going to do this is very slim.
Every year that goes by,
they cause damage.
Well, damage, but also the inclination is that they're not going to turn
Correct.
things around. Mindset after it's done, success rate, as you say, is 70 to 80%.
Yep.
What happens to the 10, 20, 30? They gain the weight back?
They gain the weight back.
Well, that's got to be a lot of stress on there's no space anymore in that stomach.
Yeah, well, the one thing that we tell people what they have to learn is that, first of all, they will not need as many calories as before. And then in our society, there's a lot of calories in tiny foods. Like a piece of cheese like this is 100 calories.
Right.
A tablespoon of mayonnaise is 100 calories. So it adds up like nothing.
It's two things I love. Then you're going to tell me peanut butter's bad too.
I can ruin everybody's meal.
Yes, I bet you can.
Sorry about that.
You sound like a great guy to hang out with, but going to dinner with you, I'd be like, oh, cripes. We got to be careful with Dr. Dieter. Downer Dieter. You ordered what? That's all right. You have to be careful not to be judgmental in your real world, right?
I'm not really. I'm not
no,
judgmental.
you don't appear to me to be one.
I understand people. I mean, it's not their fault.
Well, on the plus side, 70-80% of the folks who have the surgery feel good about themselves and successfully keep the weight off at what percentage? All of it? Close to all of it?
Well, the majority of initial weight loss is about 30% of the total weight. And then the Swedish effect looked at this for 15 years afterwards. And still people kept half their overweight off. So it's a long term, 15 years. So
moral of the story, we're out of time. It's fascinating. The moral of the story on this is what?
Surgery is underperformed. Not enough people have the surgery. Only 1% of the people who are eligible get the surgery. A lot of people walk around with diabetes, high blood pressure, and so forth. They would be doing much better. All my patients tell me, I wish I'd done this years ago. This gave me my life back. I'm active. I can have a quality of life. More people should be open-minded to this because it will change their life and it will make life much better.
Congratulations on your 16 years of success at Roger Williams.
Thank you.
Appreciate it. And all the information is on foxprovidence.com. The app, the whole weight loss calculation, the seminars, the whole bit. Thanks. I don't qualify. Trying not to qualify. Be right back.
Thank you.
Kind of shocking to hear that this kind of surgery we just talked about is generally safer than knee surgery. Everyone gets their knee and their hip replaced, right? Anyway, give it a thought. foxprovidence.com for all the information. Coming up on the Monday program, hey, there are libertarians running for the presidency and vice presidency. A former governor of Massachusetts, part of that ticket, and the chairman of the Rhode Island Committee to Elect will be here for that program. Have a great weekend. Thanks for watching. Good night.